going to demonstrate how to change out the Medtronic MiniMed Neo insertion with the 670G insulin pump. So first I've got my vial of insulin, my Neo infusion set, and my reservoir, and then of course my insulin pump. So I'm going to open up my reservoir. And before I put it on the vial of insulin, I'm going to put a little air in the reservoir to equalize pressure in the vial of insulin. So it goes straight down like so. I'm going to press the air into the vial and then turn it upside down and pull back to the amount of insulin I need to fill in my reservoir. Then when I have it filled, I'm turning it right side up, twisting once from the reservoir, from the needle connector, and pulling straight off. Then I'm going to remove the blue portion from the vial. And the blue, that's now garbage, and there's the vial of insulin. I'm going to open up the Neo infusion set, starting with that red tab first. Remove the plastic, flip off the lid, and then I'm going to unwind the tubing. It's caught on a little plastic piece there. Just going to pull forward and release it, and then unwind the tubing. Being careful you do not pull it too far and pull the entire set out. So now I've got it unraveled. I'm going to connect the reservoir to the tubing, putting them together and gently twisting until I can feel them align, and then press down and twist to lock. At this point, if you have any little air bubbles in your reservoir, you can use your plunger and just gently push them to the top of the tubing. Then remove the plunger, the reservoir, and that then becomes garbage. Then I've removed the back piece of paper from the Mio. I hold down the front of the set and remove the blue needle cover. Then unravel the tape that is around the needle. To get it loaded, hold the ridged areas, not the smooth, but the ridged, and pull back until you hear the click, and you've got the Neo infusion set loaded. Then go to the 670 pump, go into the main menu, go down to options, go into reservoir and tubing. From reservoir and tubing, click on new reservoir. It gives you the steps: remove the infusion set from your body, remove reservoir. So if you've got an old one in there, this is where you would twist it out and remove the site from your body and throw it away. Now we're going to rewind, which is causing the gray piston in there to rewind down to the bottom. And then once it's done, it tells you rewind is complete. Then new reservoir, fill your reservoir, connect tubing to reservoir, do not connect body. So I've already done that step, so I'm going to hit next. Place reservoir into pump and lock, do not connect body. So now the new reservoir is going into the pump. I'm clicking next. Now I need to load the reservoir. So load is just holding the center button down and waiting for that gray piston to go up and make contact with the reservoir. My reservoir isn't filled all the way, so it takes a little longer for it to make its way up there to connect. Okay, and next I'm going to fill the tubing, which means just pushing insulin through the tubing until I see drops appear at the end of the needle. And I'm doing that by just holding the center button down. I see the drops, so now I'm going to next on my pump. Okay, so next is fill the cannula, and that step is done after it's inserted in your body. So pick an area, clean it with alcohol or just make sure skin is clean, and then you just go to that area, place the set against your body, making sure though that you are not putting any pressure against your skin. Just set it, and then you are going to press the smooth buttons, not the ridged, but the smooth, and that puts the set in. So press it. That went in. Now I'm going to just press in on the white center portion to make sure it's adhering, and then straight out pull the needle away. Always check to make sure the needle, once you've removed it, is straight. If you pull the infusion set away from your body and you bend this at all, that needle could be bent, which means you could possibly have a kinked cannula. So I've got the set placed. Now I'm going to go back to my pump, and it is saying fill cannula. So I'm going to press fill, and my fill amount is 0.300. So now I'm going to go down, fill now. And then once that is complete, my infusion site change is done. And that is how you do the Mio infusion site.